Hi, my name is Cindy Martinez and I am a professional soccer player with Brooklyn FC.
Hi, my name is Scheriff. I'm a professional footballer with Brooklyn FC.
I'm here at NYU Langone with Dr. Desai
to discuss how much I know about the medical side of being a professional athlete.
Are female athletes more likely to suffer hamstring injuries than male athletes?
I feel like no. I feel like males would be more likely to suffer hamstring injuries just because women are always typically more flexible and everything, and so our muscles bend and everything easily, whereas men are strong and stiff. So I feel like they could strain up easier.
You are correct. It is 2/3 of hamstring injuries are typically male versus females. And it probably is a little bit of the load bearing and the flexibility of the hamstring. It may be also the disparity between the quad and hamstring in terms of strength and the pull. It's definitely more important to have that flexibility and to make sure that you also have the strength to balance that powerful quad that all soccer players have.
True or false? Injuries require the same treatment plan for every athlete.
False. I think every athlete is different, and I would assume you'd have to treat every injury differently.
I think that is a general, falsehood. Every athlete is different, every expectation, every injury is different from one hamstring strain to another. So I do think that there is, in general, you have to individualize the approach. Here, we try to take all the imaging up front, get all the information between the x-rays, MRIs, and even in-room ultrasound to see how much swelling and injury there actually is. And then also take into account the athlete in terms of what position they play, where they are in season, and that can help us decide how aggressive we're going to be in terms of rest, in terms of interventions. We really work with your team's athletic trainer, the physical therapist, and everything to come up with a plan for you. I think the overall theory between males and females is still there. It's the timeline and how you approach that recovery that's going to be different between athletes.
Are there any muscle injuries that are more common in female athletes?
So in general, the big muscles like the quad and the hamstring are going to have a more male predominance, and it's for a lot of the reasons that you mentioned. The hip flexor is meaning the psoas muscle is particularly vulnerable in females versus males only because of our hypermobility in females. And so, especially soccer players who are kicking and really extending that hip to pretty significant degrees in some instances, there can be a little bit of discrepancy between males and females.
Does joint flexibility always mean a lower chance of injury?
No. I like to say that you can be extremely flexible and still have the likelihood of obtaining an injury the same way someone else may.
You are correct. I think joint flexibility is kind of a trick wording because we're talking about muscle flexibility, and we definitely want muscles to be flexible and absorb load as you're, being explosive while playing. Joint laxity, which females have more joint laxity, our joints move more than males on average, requires a lot of strength to support it. So if you don't have that strength across the joints, you actually can be predisposed to more injury. We can affect our flexibility of the muscles. That's by stretching and recovery and strengthening. That all affects the flexibility of the muscles. And ligaments, you're kind of born with a certain amount of stretchiness of the ligament. And everybody's laxity of their ligaments is a little bit different, and women tend to be a little bit more lax. So if your joints are super lax, I would say you probably are more predisposed to injury if you don't have the strength to support them.
Is hypermobility an advantage or disadvantage in professional athletes?
I think it can be both. I know from my position it helps me out a lot. I need to be very mobile, I need to put myself in really awkward positions, but it also comes with a lot of risk because I am putting myself in positions that my body shouldn't typically be able to do, and it causes problems here and there.
Yeah, I couldn't have said it better myself, and your experience is exactly what I try to tell my patients here. And I think the hypermobile joint is somewhat an adaptation to what you're doing, to what some of these, some different professional sports require your body to do. But the repetitive stress and the pull on unnatural angles of your joint will can lead to significant injury and pain. And so really having that strength to support the joint, load managing, making sure you're not doing so much repetitiveness in those hypermobile positions are definitely going to be ways to protect your joints.
What is the most common preventable injury in professional athletes?
I feel like it's a trick question, but I feel like maybe stuff with your muscles, so like muscle strains, because you're in control of how much you can warm up and prepare for games.
I think that's a great answer. I don't know if there's a definitive answer in research, but it's going to be overuse injuries and things like muscle strains, tendinitis, even stress fractures, anything that is a load management problem. I think if you appropriately warm up and stretch and do the right amount of volume that for your body and in your training program, it should prevent most injuries and of course a good recovery period as well.
Can proper nutrition help regulate your menstrual cycle?
I feel like the answer to this is yes, it should be. I think if you take care of most of the things that your body needs, then it should be able to like regulate your menstrual cycle.
Correct again. So nutrition is vital for your menstrual cycle. The menstrual cycle is your body's readiness to create a baby if it's the right time, or to have your period, right? And that cycling is very dependent on your caloric intake and the hormonal regulation between all the different areas of your body. If you're not balancing the amount that you're expending and the amount that you're taking in, if you don't have an adequate level of calories, then it is going to steal from your normal menstrual cycle. You're not going to have the adequate energy molecules to support appropriate cycling.
Do hormone fluctuations affect muscle recovery?
I feel like they definitely do. I feel like when my hormones are thrown off balance, I definitely, no matter how much I can help recover myself, whether it's an ice bath, stim, whatever, I definitely don't always feel as recovered as I would when I feel in sync with myself.
Yeah, and I think you put it perfectly. It's not like a part of your menstrual cycle or that kind of fluctuation, is how healthy you are and how well your endocrine system is working. And that kind of touches on the other question, that the better your nutrition and your caloric intake matches your expenditure and your body is in balance nutritionally, the better your endocrine system will function from your thyroid and your menstrual cycle, and you will feel better when all of that is working well for you.
Hi, I'm Dr. Abby Campbell.
And I'm Dr. Natasha Desai.
We're here at NYU Langone Center for Women's Health.
And we are the official team doctors of Brooklyn FC's women's team.